1. A nurse is caring for an older adult patient with osteoarthritis who reports chronic knee pain rated as 6 out of 10. What is the most appropriate initial nursing intervention? Answer. Assess the patient's activity patterns, pain triggers, and current pain management strategies. Rationale. A thorough assessment must precede any intervention to determine the nature and contributing factors of the pain and guide effective management. 2. An adult patient with osteoarthritis asks why they are being advised to lose weight. What is the most appropriate response by the nurse? Answer. Losing weight reduces stress on weight-bearing joints and can help alleviate symptoms. Rationale. Excess weight increases mechanical stress on joints, especially knees and hips, exacerbating osteoarthritis pain and progression. 3. The nurse observes that a patient with osteoarthritis avoids walking due to joint pain. What is the most appropriate nursing action? Answer. Encourage low-impact exercises, such as swimming or walking in a heated pool. Rationale. Exercise promotes joint flexibility and muscle strength. Low-impact activities minimize joint stress while maintaining mobility. 4. A patient with osteoarthritis is prescribed NSAIDs. What should the nurse monitor as a priority? Answer. Monitor for gastrointestinal bleeding symptoms, such as dark stools or abdominal pain. Rationale. NSAIDs increase the risk of gastrointestinal bleeding, especially in older adults, and must be monitored carefully. 5. A nurse is planning care for a patient with osteoarthritis. Which intervention should the nurse delegate to the unlicensed assistive personnel, UAP? Answer. Assist the patient with ambulation using a walker. Rationale. UAPs can safely assist with mobility as long as the patient is stable and no new assessments are needed. 6. A patient with osteoarthritis is prescribed acetaminophen. What teaching should the nurse provide? Answer. Do not exceed 4,000 milligrams of acetaminophen per day to avoid liver damage. Rationale. High doses of acetaminophen are hepatotoxic, and patients must be educated on maximum safe daily limits. 7. A patient with osteoarthritis tells the nurse that they apply heating pads throughout the day. What is the most appropriate nursing instruction? Answer. Use heating pads for 20 minutes at a time and monitor for skin breakdown. Rationale. Excessive heat exposure can lead to skin burns, especially in patients with decreased sensitivity. Time limits help prevent this. 8. A nurse is caring for several patients. Which patient should the nurse assess first? 1. A patient with osteoarthritis reporting morning stiffness. 2. A patient with osteoarthritis with a fever of 101.2 degrees Fahrenheit. 3. A patient with osteoarthritis requesting a warm compress. Answer. Assess the patient with osteoarthritis and a fever of 101.2 degrees Fahrenheit first. Rationale. Fever is not typical of osteoarthritis and may indicate an infection or another complication requiring immediate evaluation. 9. A nurse is teaching a group of patients with osteoarthritis. Which point is most important to emphasize regarding long-term management? Answer. Regular exercise, joint protection, and weight control are key components. Rationale. Lifestyle modification is the foundation of osteoarthritis management and helps reduce symptoms and progression. 10. A patient asks whether glucosamine supplements are useful for osteoarthritis. How should the nurse respond? Answer. Some patients report symptom relief, but evidence is limited and should be discussed with the healthcare provider. Rationale. While glucosamine is popular, its efficacy is inconclusive, and use should be discussed before starting to avoid interactions or false expectations. 11. A patient with bilateral hip osteoarthritis reports worsening pain and stiffness despite adherence to treatment. What is the nurse's best response? Answer. Notify the healthcare provider for possible evaluation of disease progression or treatment modification. Rationale. Worsening symptoms may indicate advancing disease or inadequate management, requiring provider reassessment. 12. A nurse is assigning care. Which patient with osteoarthritis is most appropriate to assign to an LPN/LVN? Answer. A patient who needs scheduled NSAID administration and routine assessment of pain. Rationale. LPNs can administer medications and perform focused assessments on stable patients under the direction of an RN. 13. The nurse is caring for a patient newly diagnosed with osteoarthritis. What is a priority teaching point for preventing disability? Answer. Maintain a consistent program of joint-friendly physical activity. Rationale. Regular exercise preserves joint mobility, delays disability, and enhances overall function in osteoarthritis. 14. A nurse receives morning shift report. Which of the following osteoarthritis patients requires priority assessment? 1. A patient reporting increased swelling and warmth in the knee. 2. A patient requesting assistance with dressing. 3. A patient who did not receive their morning dose of acetaminophen. Answer. Assess the patient reporting increased swelling and warmth in the knee. Rationale. Swelling and warmth may indicate infection or another complication and require urgent evaluation. 15. A patient with osteoarthritis is prescribed topical capsaicin. What should the nurse instruct the patient about its use? Answer. Wash hands after application and avoid touching eyes or mucous membranes. Rationale. Capsaicin can cause burning or irritation, especially if it contacts sensitive tissues. Proper hand hygiene prevents this. 16. A patient with osteoarthritis is having difficulty performing ADLs due to joint stiffness. What is the most appropriate nursing intervention? Answer. Refer the patient to an occupational therapist for adaptive strategies. Rationale. Occupational therapy helps patients maintain independence by teaching joint protection techniques and recommending assistive devices. 17. During a home visit, the nurse notices that a patient with osteoarthritis has loose rugs and poor lighting. What is the nurse's priority action? Answer. Educate the patient on fall prevention and assist in removing environmental hazards. Rationale. Osteoarthritis affects mobility and balance. Minimizing fall risks is essential to ensure patient safety. 18. A patient with osteoarthritis asks about joint replacement surgery. What should the nurse explain as a typical indication? Answer. Joint replacement is considered when pain is severe and unresponsive to conservative treatments. Rationale. Surgery is generally reserved for advanced osteoarthritis, where pain and function are not improved by non-surgical methods. 19. A patient with osteoarthritis wants to use herbal remedies for pain. What is the nurse's best response? Answer. Discuss herbal use with your healthcare provider to ensure safety and prevent drug interactions. Rationale. Herbal remedies may interact with prescribed medications, and safety should be reviewed by a medical professional. 20. A nurse is teaching a patient with osteoarthritis about managing morning stiffness. What recommendation is most effective? Answer. Take a warm shower in the morning to loosen stiff joints. Rationale. Warm showers help improve circulation and joint flexibility, easing stiffness common in osteoarthritis. 21. A patient with osteoarthritis reports difficulty sleeping due to chronic joint pain. What is the nurse's most appropriate initial action? Answer. Assess the characteristics and timing of the pain and its impact on sleep. Rationale. A detailed assessment is necessary to determine the cause and guide individualized interventions for pain-related sleep disturbances. 22. A nurse is educating a patient about assistive devices for osteoarthritis. Which instruction is most appropriate? Answer. Use a cane on the opposite side of the affected joint to reduce joint stress. Rationale. Using a cane on the unaffected side improves balance and reduces weight load on the affected joint, decreasing pain. 23. A nurse is providing community education about osteoarthritis. What lifestyle habit should the nurse emphasize as a modifiable risk factor? Answer. Maintaining a healthy body weight to reduce stress on joints. Rationale. Obesity significantly increases joint wear and tear, particularly in the knees and hips, making weight control essential. 24. During a clinic visit, a patient with osteoarthritis reports using multiple over-the-counter creams and supplements. What is the nurse's priority action? Answer. Review all current medications and supplements for potential interactions. Rationale: polypharmacy and self-treatment can lead to harmful interactions or duplications, especially in older adults. 25. A nurse is planning discharge teaching for a patient with osteoarthritis. Which statement indicates a need for further teaching? Answer: I will rest completely when I have joint pain and avoid all movement. Rationale: complete rest can lead to stiffness and decreased mobility. Patients should engage in gentle movement even during flare-ups. 26. A patient with osteoarthritis has difficulty standing for long periods while cooking. What should the nurse suggest? Answer: use a high stool or chair to sit while performing kitchen tasks. Rationale: energy conservation techniques, like sitting during tasks, help reduce fatigue and joint strain. 27. A nurse receives a call from a patient with osteoarthritis who reports sudden joint swelling, redness, and fever. What should the nurse advise? Answer: seek immediate medical evaluation to rule out septic arthritis. Rationale: sudden inflammation and systemic symptoms are not typical of osteoarthritis and may indicate infection requiring urgent care. 28. A nurse is reinforcing teaching on proper use of NSAIDs in a patient with osteoarthritis and hypertension. What is the priority point to emphasize? Answer: NSAIDs can raise blood pressure and should be used cautiously under medical supervision. Rationale: NSAIDs can cause fluid retention and increase blood pressure, making them risky for hypertensive patients. 29. A patient with osteoarthritis asks how often joint X-rays should be taken. What is the nurse's best response? Answer: joint X-rays are typically done when symptoms change or worsen, not routinely. Rationale: imaging is used for diagnosis and monitoring progression, but not required regularly unless symptoms suggest changes. 30. The nurse is supervising a UAP caring for a patient with osteoarthritis. Which action by the UAP requires intervention? Answer: massaging the patient's swollen knee joint without prior instruction. Rationale: swollen joints may indicate inflammation, and massage without assessment may worsen the condition or cause harm. 31. A nurse is evaluating a patient's understanding of home safety to manage osteoarthritis. Which statement indicates appropriate understanding? Answer: I remove the rugs in the hallway to prevent tripping. Rationale: fall prevention is critical in patients with limited joint mobility and balance due to osteoarthritis. 32. A patient newly diagnosed with osteoarthritis asks, what changes can be expected over time? How should the nurse respond? Answer: joint degeneration may progress slowly, but symptoms can be managed with lifestyle changes and medication. Rationale: osteoarthritis is a chronic progressive condition, but appropriate management can slow progression and reduce symptoms. 33. A nurse is preparing an educational session for elderly patients with osteoarthritis. Which topic should be prioritized? Answer: safe exercise options tailored to joint limitations. Rationale: promoting safe movement prevents deconditioning, reduces pain, and preserves joint function. 34. The nurse is caring for a patient with osteoarthritis experiencing depression related to decreased independence. What is the nurse's best action? Answer: refer the patient to a mental health provider for further support. Rationale: chronic pain and reduced function can lead to depression, and early mental health referral improves outcomes. 35. A nurse is discussing activity planning with a patient with osteoarthritis. What is the best strategy to recommend? Answer: alternate periods of activity with rest throughout the day. Rationale: balancing activity and rest prevents overexertion and joint stress while maintaining function. 36. A patient asks about surgical options for osteoarthritis. What should the nurse explain about arthroscopy? Answer: arthroscopy may be used for minor joint repairs, but is not typically a cure for osteoarthritis. Rationale: arthroscopy can help with specific mechanical issues, but does not halt osteoarthritis progression. 37. A nurse is caring for a patient post, total knee replacement due to osteoarthritis. What is the priority assessment during the first 24 hours? Answer: monitor neurovascular status of the affected limb. Rationale: early detection of compromised circulation or nerve function is critical after orthopedic surgery. 38. The nurse is evaluating a patient's response to non-pharmacologic pain interventions. Which outcome indicates effectiveness? Answer: the patient reports reduced pain after applying warm compresses. Rationale: warm compresses can relieve joint stiffness and discomfort, and subjective pain relief indicates efficacy. 39. A nurse is educating a caregiver of a patient with advanced osteoarthritis. What is a key teaching point to reduce caregiver strain? Answer: use assistive devices and adaptive equipment to reduce physical burden. Rationale: proper tools can reduce the effort needed for caregiving and protect both the caregiver and the patient. 40. A patient with osteoarthritis states, "I can't do anything anymore." What is the most therapeutic nursing response? Answer: let's talk about the activities you enjoy and how we can adapt them. Rationale: focusing on ability rather than disability supports self-efficacy and promotes emotional well-being. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!